Hello, everybody. Welcome to our HRS data workshop today. I'm Shiyang Zhang, a PhD student from the Department of Human Development and Family Science. And I'm also a member of the Texas Aging and Longevity Center Graduate Student Council. So today it's our honor to have Dr. Ijung Kim here to give us an introduction to the HRS dataset. Dr. Kim is a postdoc scholar affiliated with the Population Research Center in UT. She received her PhD degree from University of Massachusetts, Boston. Dr. Kim's research mainly focuses on older adults' family relationships and individuals' aging perceptions. She has published a series of studies on top-tier journals and book chapters about intergenerational relationships. She is a receiver of the Gerontology Society of America's James McConney Student Award, and also the receiver of APA Division 20's Research Award. Dr. Kim is also experienced with the HRS dataset. So today, she will offer us an introduction to the HRS dataset and also cover practical information, including how to merge different datasets, identify variables of interest, and create longitudinal analytic files. Please join me in welcoming Dr. Ijung Kim.
All right, thank you. Thank you, Xiang, for that wonderful introduction, which I did not expect, but thank you so much for the TALC Graduate Student Association for inviting me for this talk. I'm here to share my experiences of using the health and retirement study. So let me begin by saying that I'm not an HRS expert. My first experience with the HRS was during the second year of my PhD program at the University of Massachusetts, Boston. So, and in our program, we have a one-year course called Current National Databases in Gerontological Policy Research that is required for every PhD student to complete their master's thesis. And no one called it by that name, and the course was just simply known as the HRS. And so you can begin to grasp how vast and rich this data set is. And I really only know about the variables and topics that I've worked with. But this is probably also the reasons why many people might be interested in using the HRS, but have not been able to do so. So today's talk is really about introducing the health and retirement study to those who have never used or who tried using it but got lost somewhere. So the three broad topics for today's talk are about the kind of data available in the HRS, accessing the HRS, and creating analytic files using the HRS. The HRS was created in 1990 by an act of Congress and launched in 1992 at the University of Michigan's Institute for Social Research to study economic, health, and retirement information of Americans aged 50 years and older. It has since then grown to include biomarkers, genetics, and psychosocial content as well. There are three characteristics that really define the HRS and distinguish it from other studies. First, HRS is the largest and the most comprehensive nationally representative multidisciplinary panel study of Americans over age 50. Second, HRS follows individuals and their spouses or partners from the time of their entry into the survey until death. And finally, HRS can be linked to various administrative data such as Social Security and Medicare. And now I'm going to explain these characteristics in more details. For the first point, I'm going to mention the HRS sample very briefly. The first HRS cohort was surveyed in 1992, and then those were people were between 51 to 60 years old back then. Then HRS actually added an older cohort in 1993 to capture asset and health dynamics among the oldest old, then age 70 years and above. And in 1998, the two studies merged and the two new cohorts were enrolled to make the sample fully representative of the USA population over age 50. And since then, HRS actually replenishes their sample with a new cohort every 6 years. So from 1998 and on, the HRS, this is the worst. Can you guys hear it a lot more? Yeah, sorry. The HRS surveyed these individuals every 2 years, and you can see here that a new cohort was added every 6 years. So in total, the HRS panel study has information on 7 different cohorts of older adult population. Next, HRS follows individuals and their spouses or partners from the time of their entry into the survey until death. And this is possible because HRS is sampled at a household level. A primary respondent is randomly selected from all age-eligible household members. And if this selected person is single, then the person answers all questions. However, if the selected person is coupled, then HRS also includes their spouse or partner in the sample, regardless of their age. Then HRS designates a financial respondent and a family respondent so that the questions that either one of the spouses can answer aren't asked twice. HRS data can also be linked to administrative data. HRS attempts to obtain permission from all HRS respondents to access linked survey data to Social Security earnings and other, if they're eligible, Medicare records. And please note that I personally have never done this, but I believe there are other additional steps involved given the sensitivity of the information. And now I'd like to talk about how all these information are organized as data. The HRS public survey data is the first step to working with the HRS, and each interview year has 3 main files: the core, exit files, and post-exit files. Exit and post-exit file interviews were done by proxy respondents, who are usually spouse or other family member, in the event of respondent's death, and contain information on medical expenditures, family interactions, and other circumstances during the final stages of life. Core file is what you need for most of your research. There are other files on this page, but everything is based on the information from the core files. And finally, there's COVID-19 data that was recently added as a special chart piece. The core survey takes place every 2 years, and this is the main part of the data. Sample size ranges from 18,000 to 23,000 any given wave. HRS puts a lot of effort into asking the same or at least comparable questions over the study waves, but each core is not identical. Each core file also includes experimental modules and enhanced face-to-face questions, which were asked to a subsample of the core respondents, and I'll explain this in more detail later. Here is the example of the codebook for the HRS 2008 core file, and as you can see, the core file contains a wide variety of information on individuals' demographics, background, health services, insurance, employment, pensions, economic status, family structure, and so on. And I briefly mentioned that each core file also includes modules. These experimental modules ask questions on specialized topics, which were gathered from the research community prior to each wave. Random subsamples of approximately 1,500 respondents are asked to complete this module at the end of the interview. What is probably more relevant to all of us is the enhanced face-to-face questions. Enhanced face-to-face began in 2006, where half of the core sample is randomly assigned to face-to-face interview, enhanced with physical and biological measures in a mail-back psychosocial questionnaires. And these include information on physical measures like grip strength, height, weight, blood pressure, saliva sample for genetic information, blood-based biomarkers, and psychosocial lead behind questions. It's important to know that data collected through enhanced face-to-face interviews is available every wave on a half sample. So this means that the information for the same person is available every 4 years. So if someone's interview in 2006 can be linked to their interview in 2010. Finally, HRS has off-year and supplemental studies, which takes place in between interview waves. And some of them take place only once, others are of varying durations. And all of these have specialized purpose, so if you are interested, you have to check them out individually. And before we move on to actually creating data set using the HRS, I want to mention the HRS International Sister Studies. These sister studies offer the opportunity for cross-national comparisons. HRS sister surveys include comparable longitudinal data from Mexico, Brazil, England, Ireland, Scotland, Northern Ireland, 18 countries in the European network, South Africa, Indonesia, Korea, China, India, Thailand, Malaysia, and Japan. I hope I didn't miss anything. And this cross-country comparison is possible through the website called Gateway to Global Aging Data. And this website is managed by the USC program, and they have created harmonized data sets that allow users to compare identically defined variables across countries. And this is another big source of data that I have not personally used, but it shows you how far the HRS can extend, and you should certainly take advantage of it if you're interested in cross-country comparison. And the best resource to finding out more about health and retirement study is through their website. The website offers free webinars, tutorials, and other graphics. And I also recommend reading the Sonega et al. 2014 paper if you're interested in more details. All right, next, let's switch gears and talk about how to actually access the HRS data. And this is the front page of the first page that you will end up with if you go to the HRS website. And where we're going is the media and researchers section of the HRS website. You'll then be at the main page. And if you have never used the HRS before, then I recommend you go straight to the documentation tab. And then go straight to Codebooks. Now, just pick one of the cores. So here you'll see the latest HRS data is the year 2018. And this is the early release of data, which is why it doesn't have the post-exit as all the other files are from the other years. So the early release just means that the data has not been as thoroughly cleaned as per usual HRS standard, and it does not include results of blood tests. So we're going to look at the 2016 HRS core, which is the final release. And you'll see this long list of sections. And just get a kind of feel of each item by clicking each section. And that's a good way to get introduced to the data set. And you'll also notice that each section has different labels attached in parentheses. And these indicate the levels of files. And I think most of you would just need to know the difference between household level files and a respondent level file. Household level files contain questions that were asked about the household. So it contains one record for each household. So for example, questions like, do you live in the same city as last wave? That doesn't need both spouses answer. Just one of them could answer the question without a problem. So respondent level files were asked to all respondents, so contain each one record for each respondent. And now there are other categories such as sibling or helper. And honestly, this is where I want to tell you that you don't need to know all of this unless there is a specific variable in these sections that you are interested in. In that case, I recommend that you go to data descriptions under documentation tab, go to data products if you have a question on, and just the usual search, Control F, and type in the keywords, and it will give you a thorough explanation of what that means. So we're actually gonna download the data and merge in this workshop. And I'm going to show you an example of how I identify variables and merge data sets. So let's hypothetically assume that I'm interested in finding out longitudinal associations between individuals' relationship equality with a spouse or partner and depressive symptoms in later life. And I know I want to include some health variables like self-rated health in the model. And I also want to control for the usual demographic variables such as age, gender, and race, etc. And so my primary variable of interest is relationship quality, and it's a psychosocial variable. So the first place I'm going to go to is the user guides under the documentation tab. And these guides include documentation about the concepts, measures, and questions in the HRS survey. In my case, I know that the relationship quality variable is a scale composed of multiple items. And so I want to download and read this document called HRS Psychosocial and Lifestyle Questionnaire 2006 and 2016. And I think I can show you this. And it's documentation composed of, basically gives you how, for example, like loneliness, where you can find the items, as well as what each of them are, the codings, and then how you should code each item, reverse code certain items to create a scale. So this is a very useful document if you are interested in using a psychosocial variable from the HRS. And so for my item, relationship quality, I see that it gives me an item number, and that changed between 2012 and 2014. So it was Q4 to Q18 in 2006, all the way to 2012, and then Q3 to Q17 in 2014 and 2016. So I wrote down my code names for the psychosocial variables, and I want to get my health information variable, let's say. And for now, let's find the self-rated health variable because it's a single item variable. And to do this, we're going to use the question concordance tab, which will ask, and it's under the documentation tab, and which will let you type in your search terms. So I've typed in self-rated health, and I'm going to select the years that I'm interested in as 2006 and up, because that's all the information I have about the relationship quality variable. Remember, relationship quality variable wasn't measured before 2006, and that's why we're starting at 2006. And if I scroll down a bit after this search, and I'll see the question that I want, and its variable name is KC001 in 2006. And would you say your health is excellent, very good, very poor? So that's the self-rated health question. How do I know how the same variable was named in different ways? So to find this out, I can click on view cross-reference right next to the variable names. And this will give me variable names of self-rated health across all HRS studies. So I see that it was KC00. And now I need my CSD items. And this is where I'm going to introduce you to another data product, longitudinal RAND HRS data. And you really don't need to know much about this in detail, except that the RAND Corporation has cleaned and imputed a variety of derived variables from the HRS raw datasets. And this data set includes many key variables like CSD scales that researchers are interested in. It's very user-friendly. And the examples on this slide are 6 SHLT. It shows you that self-reported health, the item we actually found in the core health, is actually available in this RAND longitudinal file. And I used the raw file just for the sake of the example. And what we need is RAND HRS longitudinal data codebook. So to get that, let's go to the RAND HRS data under the data products tab. Click on the RAND HRS longitudinal data file 2016. So it just means it has data all the way up to 2016. And download the codebook. And this is, and it's a 1,600-page codebook, so it will take you some time to go through it. But basically, RAND has created, for example, CSD in this case, which is the variable that we're interested in. RAND has already cleaned and created a scale of CSD, and it's a single item. So we don't have to go about and do all the recodes for each item, get the mean for multiple items, and all of that. So that's why this RAND longitudinal data is so useful. And So again, we went through this, but the codebook tells me that our WCSD is the score for the CSD scale. And W here is just a number that indicates certain study weight, and we'll talk about this later. And now the only thing that are left for me are demographic variables. And this one's really easy because to get this information, we're going to use another data file called cross-wave tracker file. The HRS tracker contains one record for every person who was ever eligible to be interviewed in any wave. And each record contains basic demographic information and interview status per person. And it's tracked cross-wave. So, and the codebook for the cross-wave tracker file can be found also, again, under codebooks. And putting all of these together, we have identified 4 different sources of data products to locate our variables. And again, please note that for the sake of examples, I looked for self-rated health in the core file, but this variable does exist in the RAND HRS longitudinal data file. So we just really need 3 different data sources. And at this point, I would like to say a few takeaway points. First, basic demographic information is in the cross-wave tracker file. And next, look through the RAND HRS longitudinal file and its codebook because they have already cleaned and imputed all data for you. The chances are most of the variables you want to include in your model are already there in the RAND HRS longitudinal file. Many of you might be interested in psychosocial variables as outcomes or predictors. Read the documentation to know where to find them and how to use them, how to recode and use them. And finally, use question concordance and cross-reference to locate variable names in other cases. And now we're going to merge all of this to create our own data set. HRS is all about merging, as you can see. And you can do this in the program of your choice. And HRS offers merge statement files for SAS, SPSS, and Stata. And I'm going to use Stata 16, and we're going to merge 2006, 2010, 2014, and 2018 HRS files. And this is because, again, our psychosocial variable relationship quality were asked in the Leave Behind survey, and it was only asked in alternate waves, so it can only be tracked 4 years apart. And we'll be dealing with 4 different sources of data products. As we talked about, we know that we can get demographic information from the HRS cross-wave tracker file. This age, level of education, race, ethnicity, you name it, it's all there. And then we know we can get depressive symptoms and self-rated health too from the RAND HRS longitudinal file. However, the relationship quality variable, which was asked in the Leave Behind survey, is not in the RAND HRS longitudinal file. This means that we have to get this from the raw HRS file. And RAND has another version that's called RAND HRS FAT files, which are just like the HRS raw files, but again, just made more user-friendly through the RAND corporation. Now, the problem here is that we want information from the HRS 2018 data as well. And HRS 2018 data is still an early release, meaning that RAND hasn't had time to clean the data yet. And this means this is the time I really need to go and find all these items from the actual HRS 2018 core data sets. So you'll end up matching 8 different files because HRS 2018 core is now yet processed by the RAND. And this is where I want to emphasize that if you are interested in using the HRS, use the HRS FAT files in all cases that you can, because the complexity of matching the HRS raw file is that you have to match section by section. So the whole HRS core isn't available as a single data set. Each section is available as a single data set. And that's why in the case of 2018 HRS file, we have to match section C, which has self-rated health, to section D, which has depressive symptoms, to section LB, which has relationship quality. And this is so cumbersome and so much work. And that's why I think a lot of people get really discouraged from using the HRS. But if you use the FAT files, the FAT file contains everything for that given year. And all of these data products can be downloaded from the HRS website and after a simple registration. And this is where I would like to show you actually how I merge data set using Stata. And I don't know how many people here use Stata. And this is why it's just an example. Let's see. Okay. First of all, I'm going to show you the files that I downloaded from the website. I purposely did not change the names. So these are the actual names that you will see when you download these files from the HRS website. So this is the tracker file where we're going to get all the demographic information from. RAND HRS, this is the RAND longitudinal HRS file, which tells you that it contains longitudinal files from 1992 to 2016 on select variables that RAND decided to take and clean and impute. And next, I have age 16, age 14, well, age 10, and all of this are the RAND FAT files, meaning that each of these folders, so this one contains data, this single data set contains everything from the HRS core 2006. This single data set contains everything from the HRS core 2010. Again, this for this 14. And for the HRS 2018, this is where we talked about how we need to match section by section. And this is because it's a HRS for all data sets. So I have two sets of files here. One is the data. Each of this is a section, and that's why we have to merge section by section. And then I have to tell Stata where to look for these files. And so each section has Stata codes attached. So these two folders are just for 2018 HRS. And now, so I'm going to start with the tracker file. So tracker file, again, is where you get your demographic variables. And here I'm just going to get a few variables that tells me birth year, gender, race, ethnicity, and education for each respondent. And it's really important for the tracker file that you have to change the DCT file directory. What does that mean? It's, again, when you download the tracker file, go to the folder. There's going to be a DCT file. It's a dictionary file, basically, that tells your program of choice where to look for data. And I have already changed it, but this part will be given whatever the random address that HRS put in. And so you just wanna take your directory where your DA file is. It's right in the same folder. So you just really need the address of the same folder and just switch right there. And that's what I did. and then just exit out of it and just say save. And that's all you need to do really. And this tells data, if you use the in file, it's reading through the directories and okay, then this imported all information from the Crosswave tracker file. And as you can see, you can go through the code book, and these are the demographic information for every single person that was ever interviewed in the HRS. And what's important here is the ID variables. HHID is the household ID. PN is the person ID. And you just need to create a HHID-PN, which is a unique ID assigned to an each individual. And this is the ID that we're going to use to merge across data sets. So I'm going to destring these and generate HHID and sort by it. Make sure you keep, and in this case, if you're not familiar with data codes, what I'm doing is because this is such a huge file and I don't want to carry over this heavy file across all of my analysis, so I'm just going to keep my variables of interest and the 3 ID files that I want. So I have a rather condensed data set now, and this next code tells data to rename all of these variables to lowercase because data is case sensitive. And then I'm going to save this as just a different file. And you can see that it's just saved as a subset of a data subset data set. Okay, next I am going to now merge 2006, 2010, and 2014 files, and that's where we're going to use the RAND FAT files. Again, this is the raw files cleaned by the RAND, available only up to 2016 because 2018 hasn't been cleaned yet, and it's really convenient because it's again a single file that contains information for the given year. So I just really need to run this code, which tells data, read in this single file that RAND has created. It's a data file, and just keep the ID. Okay, the unique ID has already been prepared by RAND, so I don't even have to create the unique ID. And the set of variables that is about the spousal relationship quality, and I know this only because I have already looked at the code book. I think the spouse or partner understands the way you feel, and it scales from 1 to 4. So I have my variables that I want. I just want to sort by the unique ID, and then save also as a FAT file 06. And so this is a separate file now that is saved as FAT 06. And I'm going to do the same thing for 2010 to 2014. The code is not different. It just has different file names. So then I end up with now 3 files. It's FAT 06, FAT 10, FAT 14. All right, now the hard part is we're using 2018. How do we merge section by section for 2018? So now we have to do the same thing we did for the RAND, for the Crosswave tracker file, changing the directory of the dictionary. And this is where I need to already know that self-rated health comes from the C section. Relationship quality will come from section LB, and depressive symptoms will come from section D. So then what I do is I need to go to the data file, and then this is a folder that contains all the dictionary files, and then find So CR, that means 2018 core section C responded level. And you will get used to these. And I just needed to do the same thing, change the address in the directory, now not to the same files, but DA files are in this separate folder. So now you have to switch out with this address so that this data knows where to find the DA files. And basically repeat these process for section LB and section C, or section D in this case, sorry. And then the rest is very much like how we dealt with the tracker file. You import the dictionary file, meaning that it's going to import that section, the whole variable in the section C. I'm going to create a unique ID because it's not there yet. And then rename all variables to lowercase, and then just keep self-rated health and the unique ID in this case, because that's all I want from section C. Okay? So now I'm going to save this as C18 to indicate that this was the section C of the 2018 HRS data. And this is now to just repeat for section LB and section D. I infile using the DCT file, and it'll give me all the variables available in the LB section, dstring, make the unique ID, and then only keep those spousal partner relationship quality variable, which are my interest, and the ID file. Don't forget the ID file, and then save it as LB18. Same thing for section D. Just repeat. And then I just end up with these items, and these 9 items make up one single CSD scale. And then, so I have to recode this and create a scale later on, but I'm just gonna, at this point, I'm keeping the items. Okay, so I now have 3 files for each section of 2018 HRS core file. Now, CSD variable for 2006, 2010, 2014 are already made in the grand longitudinal data file. And this is just like the FAT file. HHIDPN, the unique variable ID, are already made by the RAND Corporation, and they have their naming convention. So here, R8 indicates 2006, R10 indicates 2010, R12 indicates 2014, and CSD. So this is just a single variable that RAND has already prepared for me, and it's cleaned and imputed. Tells me 2016 series CSD file and all the way up to 2014 CSD file. Variable, sorry. So that's all I need from the RAND longitudinal data file, again, saved as a RAND. And it's almost done. Now all we need to do is merge all of these files. And for Stata, this is the code that you're doing. And after merging, now you have the data set. Household ID, person ID, unique ID, demographic variables, birth year, gender, ethnicity, race, school years, and then all of the variables that we needed for between years of 2006 and 2018. So that's how you create an HRS file. Okay, so takeaway points for creating your own HRS file. First, use RAND fed files. They're just like the HRS core files, and now you know the perks of using the RAND fed files, because if not, then you have to merge items from section to section. And reusing the RAND fed files would save you so much time. In case of newer data, such as 2018 early release COVID-19 data, you do have to use the HRS raw files. This means locating where your variables are and merging section by section. If you have syntax set up to merge crosswave tracker file, rand fed files, and rand longitudinal files, 90% of the merging jobs are done for you in most cases. So invest time in creating a syntax that merges these 3 files and just stick to it. And finally, HRS does have a help desk on their website. I've never used it, but I heard that they're pretty responsive to all questions. So please use them. And that's it for me. Thank you so much for your time. And I would like to see if you have any questions or comments. I think we have time to go through them.
Yeah, thank you, Yijun. I have a quick question. So I'm really not familiar with HRS, and as you mentioned, there's a household ID and also a personal ID. So I was wondering, will there be like 2 or more participants have the same household ID? So means they are probably spouse or, I mean, siblings or something like that. So that allows me to do some analysis about that.
Yes, so HRS it's sampled at household level, meaning that HRS identifies household first. It screens households, and then it identifies a random person aged 50 years or older from that household as the primary respondent. And if that respondent has a partner or a spouse, then that respondent's spouse gets entered into the study automatically, regardless of age. So the funny thing is when you deal with HRS individual level data, you'll see that, for example, someone as young as like 25 years old is in the data. Well, that's because that person is a partner of the HRS primary respondent who is over 50 years old, and it happens quite a lot. And so you have to be mindful of that structure. Again, what happens when the respondent divorces and marries someone else or remarries? And I've actually seen a record case where this happens like 4 or 5 times in someone's life, in divorce, remarry. All of these spouses and partners gets entered into the HRS study, and they might have the same household ID. And so it gets complicated, but what I'm trying to tell you is that HRS has family level data, and dyadic studies on couple data is really, really powerful using HRS because it's got large samples and all of these items. So definitely HHID is assigned to multiple people, but how they are related to each other over time, that's a task a single researcher has to really take if you want to do research in dyadic analysis.
Mm-hmm. Yeah, so when you do longitudinal analysis, do you usually control for the household level? Because I think if you want to control for like the participant level and household level and the time and the same time, it can be really complicated.
Yeah, it can. And so, yes, and the answer is yes. You have to control for the house level because the chances are once you restrict your samples to your analytic sample, like 50% of them are going to be married or partnered to each other, so they're coming from the same household. So yes, it's the multi-level structure.
Okay, thank you.
I have a question about this. The partners or the spouses, do you have the same information then on both the respondent and their spouse, like to match them on different characteristics, or is the partner not doesn't, do they get the same number of questions?
Yeah, so the HRS, they answer the same questions on the respondent level. So for example, like the relationship quality, no one can answer your relationship quality with, for example, your child for you. So that question, where relationship quality with your child, would be asked to both spouses. But in case of other things like the family asset, did the family live in the same neighborhood last year, that gets only asked to one of the family, one of the participants enrolled in the study, even if they're from the same household, if that makes sense.
That makes sense. Thank you.
Hi, thank you for your, oh, sorry. Thank you for your talk. I appreciate it and showing us how to use this. I have a quick question that you may or may not be able to answer on the experimental modules. Were those later adapted? What's your experience with them? And were they later adapted into the longitudinal study? How would we work with those?
So experimental modules, yes. I probably don't know much about them, except that experimental modules deal with very specialized topics. And they were asked to about 1,500 respondents each wave. So compared to the larger sample, experimental module is on. The sample size is pretty small, is what I'm trying to tell you. And where I don't know for sure is if the question differs from wave to wave completely, or if there are any overlaps. However, the people have used experimental modules in their study. 1,500 people are not small. It's just when you begin to deal with longitudinal data using HRS, 1,500 sounds really small. But experimental modules are really great it deals with, for example, like in 2014 or 2010, they added this whole experimental module about older adults using healthcare information using technology and internet. So that's not in the main survey, and that only you can get from the experimental modules. So specialized topics like that, and I just recommend going through the experimental module codebook, or the best way to approach this is go to the question concordance and type in the keyword of your research interest and see what comes up. And it might just end up in the experimental module.
That's perfect. Thank you so much. The reference that or the example that you used is something that exactly I would be interested in. So thank you.
You're welcome. We have like 10 more minutes, right? Technically 5 to 10 minutes. If I am happy to answer any questions. There's anything else that you would like to know more in the future, if the HRS workshop is offered once again. Let's see. If not, yeah, it's HRS is. Mm-hmm.
I do have one more question, and it's pretty simple. You said that the exit and the post-exit were completed by the remaining spouse if the spouse had died. What about for the last remaining spouse? Who would take care of that? And is that does that drop off at any point? So if you have a last remaining spouse, who completes the exit and post-exit interview questionnaire?
Yeah, good question. And the general answer is they just say spouse or any other family member, and that's as broad as it gets. So I don't know who it is.
Okay.
Yeah, but I've never really worked with the exit or post-exit data, but I know that researchers use them a lot, especially if you're interested in like mortality or the end of life decisions. That's data set you want.
which I am. So thank you very much for bringing that up.
All right. So yeah, I mean, I guess I'll just wrap this up, and I really recommend you look through the HRF's websites. You know, they have really good tutorials on how to get started, and they are always updating their data sets. And here, this is what I recommend: use question concordance. Just begin by, you know, like what I said, just type in your research interest, key terms, start there, and hopefully, you know, you end up publishing lots of great studies using the HRS.